Pulsatile tinnitus is a type of tinnitus condition wherein a person keeps hearing a whooshing or pulsating sound that thumps in tune with the heartbeat. This condition is also called vascular tinnitus because it is commonly caused by blood flow disruption or poor blood circulation. Pulsatile tinnitus is not very common. However, the struggles an afflicted person has to go through are quite challenging. There are different types of pulsatile tinnitus, and one of the most prevalent is a condition called arterial turbulence. This is caused by restricted flow of blood that causes cramps or plaques in the arteries along the region of head and neck. The condition can worsen when the affected person suffers from high blood pressure. When this occurs, the body experiences an increased blood flow which causes the production of turbulent sound in the ears. This type of tinnitus affects a person differently from other types of tinnitus. Nevertheless, there are some people who can get afflicted by this type and another type. Those who have such conditions agree that the more annoying and irritation sounds they hear are mainly caused by pulsatile tinnitus. One thing this type of tinnitus shares in common with other types is that it is not considered a disease but rather a result of other underlying conditions. Since it can be caused by poor blood circulation or blood flow, the condition causing it must be serious and severe and must be addressed medically. One thing sufferers shouldn't be worried about is that there are treatments for this condition. Other underlying health conditions that can cause pulsatile tinnitus include 1. Arteriovenous malformations, an irregular number of arteries and veins that occur near the cranial cavity's auditory nerve. The beating sound is actually caused by the pulsation occurring in the auditory nerve. 2. Atherosclerosis, the cholesterol buildup on the artery wall causes the arterial constriction. This condition causes the blood flow to be disrupted, thereby producing a pulsating sound a tinnitus sufferer can hear. 3. Benign intracranial hypertension, this condition occurs when the fluid that surrounds the brain experiences inflated pressure. This can lead to hearing loss that is mainly characterized by hearing beating or pulsating sound. 4. Carotid artery cavernous sinus fistula, people who have this condition often experience massive head trauma which usually causes the large veins and large arteries to merge. 5. Middle ear infection or inflammation, this is one of the major causes of increased blood flow or circulation that causes sudden turbulent or pulsating sound, just like the sound heard from flowing water. 6. Hypertension, one of the major causes of pulsatile tinnitus is the intake of hypertension medications. The condition can be corrected either by changing the medicine or lowering the dosage. 7. Glammus tumor, this condition is also called vascular tumor which can occur at the base of the skull, in the middle or inside the ear. This condition can be corrected by surgery. As discussed in this article, pulsatile tinnitus signals other more severe or serious health conditions. To make sure you don't experience the symptom anymore, the underlying conditions probably causing it must be addressed and treated. If you want to learn more about pulsatile tinnitus, then visit my website www.pulsatiletinitussadvice.com.